Hi, this is Dr. Adatone Musa.
Hi, this is Dr. Hussein Musa.
I'm a board-certified epilepsy specialist and neurologist.
I'm board certified in anesthesiology, pain medicine, and addiction medicine.
Today we're going to address gaps in healthcare and how direct care can help.
Yes. And on Healing Talks with the Kingdom Docs, we talk about ways that you can improve your health. And direct care is a way that you can have immediate or very quick access to health care. And traditionally, it's been limited to primary care. And what we're doing is we're offering specialty care. So now you won't have to wait 3 months to see a neurologist. You won't have to wait 3 months to see a specialist in epilepsy. You won't have to wait 3 months to see a pain specialist. You won't have to wait 3 months to see an addiction medicine specialist. You're able to see us next day or even same day. And that's the beauty of direct care. Without the barrier of insurance, without the limitations of a referral network, you actually have the power and the ability to see and seek the help that you need and get the expert help that you need.
No referrals needed.
Yes.
Wow.
Now, last time I was talking about one of my patients. He had chronic pain for years. He had 3 back surgeries. He was on a higher dose of opioid medication, and opioids, often also called narcotics, include morphine, Dilaudid. Most notably in the news, it's fentanyl, which is oftentimes counterfeit and can be so deadly potent that patients can accidentally overdose from it. So I say all this to say is that when patients are dependent on these opioid medications, if they've run out of the medications, they start going through withdrawal.
Yeah.
Now, my patient, he was seen by his primary care doctor, and he ran out of medications because he overused it. Now, when he had a urine drug screen, that urine drug screen came back negative. So now his doctor stopped prescribing the opioid medications. So
That's jarring for the patient, right?
it's terrifying.
Yeah.
It's terrifying. So now this patient was out of medications, going through withdrawal and in pain, and it took, thankfully for him, it didn't take several months, but it took like a month and a half for him to see a pain specialist. But that's because he was so vocal and he was really contacting his doctors and the care system. He really advocated for himself, and he was able to see a specialist such as myself in about 6 weeks. Now, if that's what it takes to see a specialist when you're hurting and when you're living with that pain every moment, that's a really tough thing to deal with.
Yeah.
Now, for this patient, when I finally saw him, I was able to get to the root of his issue. Now, he had chronic pain, he had chronic back pain, he had opioid dependence, meaning that his body was physically dependent on the pain medicine. So first, we had to address the physical dependence. So there are medications that can be used to help physical dependence onto opioids or narcotics, and I was able to start him on that medication. The next issue was the chronic pain. Now, I've talked with many doctors, many surgeons, and it's not really, there is some data, but this is more understanding that by the time you get to your 4th back surgery, it's probably not going to fix the pain.
Yeah. Wow. You know, it sounds like it's not just a physical problem. It's not just, a medical or pharmacological issue. They're struggling with dependence and addiction. What else is there?
So with this patient, yes, he had pain, and yes, we started medications, but we were able to start medications that were non-habit forming.
Yeah.
So we started nerve pain medications, we started some muscle relaxants, we started anti-inflammatories that he could tolerate. We started psychological therapy, we started interventional therapy, we even started holistic care, and together with that treatment plan, we found something that started to work for him.
Right. And most importantly, the mindset changed.
The mindset is so important. And I share all this with you to say that you need time with your physician to develop that plan, and direct care can be that solution for your pain.
Well, thank you guys so much for joining us on Healing Talks with Kingdom Docs.
Visit us at kingdomdocs.com.
God bless.
Bye.